I'm getting a lot of questions about joint pain during menopause and perimenopause and what you can do. This could be knee pain, hip pain, shoulder pain, frozen shoulder. I'll give you three things that I would recommend as a starting point that might help. What I would recommend first is get an appropriate diagnosis. There may be a treatment that doesn't relate to menopause. It could be a regenerative injection therapy. It could be a manual therapy, like myofascial release of some sort, or a combination of things that help. But here are the three things that I would recommend as a starting point. Number one, consider inflammation. There's probably some level of inflammation, not only because you're going through menopause, but because it's quite common in our culture to have some levels of chronic inflammation, and that will highlight susceptibilities you have. So it can create joint and muscle pains if that's a susceptible area to you. So decreasing inflammation, the number one thing that I would do is take curcumin. Curcumin is incredible for inflammation anywhere in the body, and it's incredible for your health in all aspects, really. It's like amazing for your liver, oxidative stress, inflammation. It's great for the brain, your gut. So I would say curcumin, I usually recommend 1 to 2 grams. The second thing I would say is make sure that you have enough omega-3 fatty acids, especially EPA and DHA. Those help balance the inflammatory response in your body. So again, with that, a maintenance dose is around like a gram of that in combination. Maybe 1 to 2 grams is maybe in the area that I would recommend for that also. The third thing is physical therapy. Physical therapy is incredible for physical ailments. I can't tell you how many times I've had patients and family members and friends and people I've known that have a joint issue, muscle issue, and they go to physical therapy and they spend 3-4 weeks working on it. And by 6 weeks, they're like totally resolved, or they're at like 90%. So I really recommend doing that. If you like this content, please follow along because I provide information on perimenopause and menopause and natural medicine all the time.